Hey everyone, and Merry Christmas! Welcome back once again to Cancer's Casket. Now I'd be wearing a little more of a festive outfit today, but I don't really own anything festive, so editor me will just put like a Christmas hat or something. I'll trust him with that. So earlier this week, I came back from another cancer care appointment, and if you'll remember from one of my previous videos, I mentioned that I get a separate treatment to what normally you would expect with a cancer patient. I said something along the lines of this. Which also means I don't get radiation therapy, since if I did, my whole body would have to be radiated, which isn't the greatest idea. But instead, I get a different, fun little procedure, which I'll go over in detail in a different video. Yeah, so today I'll basically be talking about just that. So without further ado, today's topic is all about lumbar punctures. So going back to the drawing board, what even is a lumbar puncture, you may ask? Well, boy do I have a surprise for you guys, because thanks to my charm and my excellent expertise, I was able to get you guys a behind the scene footage of exactly what it is, so you guys can enjoy. Alright, so I'm currently on my computer. I've got a few videos to show you guys, but before we get there, I do want to give you guys a fair warning. You know, these are like medical procedure stuff, so if you're like squeamish or anything like that, if you don't like blood, even though there's not much blood, it's like a droplet. You've seen more in horror movies. Um, just wanted to give you as a fair warning. There is a little bit of blood. I'm not being cut open. Relax, you're fine. But there's your warning. Let's get into the first video. Alright, so here's the first video, and this one is more so me like showing the office in which my procedure is done. So this is me kind of walking in. Right here we have the bed where I would lay in, and right here we have an ultrasound machine. Now, if you know anything about lumbar punctures, you might be wondering, why am I in a room with a ultrasound machine? You know, lumbar punctures usually don't have ultrasound machines involved. And the reason why is because of the way that my lumbar puncture happens. Before I explain why they have to use a ultrasound machine for me, I should probably explain what a lumbar puncture is first. And so basically, the easiest way to explain it is that a 2 to 4 inch long needle is poked into the lower part of your back, into your spine, the lumbar area, hence the name lumbar puncture. And then what they do is they try to get the needle in between the vertebrates in the spine to go into the spinal cord and take out some spinal fluid. They kind of do this to check if there's anything, wrong in the spinal fluid, anything that shouldn't be there. In my case, any cancer cells. And what they do afterwards is they put in a little bit of chemo in the area just to kind of kill anything that shouldn't be there, and or make sure it doesn't come back. So that's kind of explaining quickly and in a very crude way what a lumbar puncture is. The reason why I had to explain that is because typically lumbar punctures are done under anesthesia. You're put to sleep. However, for me, since I'm older, my vertebrates are way closer. Like with a smaller kid, a younger kid, their vertebrates are farther apart, and what they typically do is they just kind of eyeball the area where they poke, and they poke and try to get it out, get the fluid out. But since I'm older, it's a lot harder to eyeball it. And so what they did the first time, they tried doing it under anesthesia, but the best way I can explain it is it didn't look very good. Like, I was asleep, I didn't see what happened, but I had someone there with me who saw the procedure, and based on their testimony, they kept saying something along the lines of the fact that it looked like I was being stabbed repeatedly with a 4-inch long needle in my back. Like boom, boom, boom. So after that, we all kind of collectively agreed, hey, you know what? Maybe it's best if we do it with a ultrasound to get it easily, done and over with, and not poke me or stab me like 50 times in the back. So that's kind of the story for the ultrasound. Anyways, the rest of the video, or the 16-minute clip that I have for this one, is just kind of showing you the rest of the room. It's like really like children focused. The reason why is because I'm in a pediatric unit.
I started when I was about 16, my treatment, so technically I was still under like the pediatrics unit. And even though I'm 18 now, you know, I still am under their care. So technically I have to still go to them. So it's just, it leads to a few funny conversations every once in a while. You know, like I'll be walking down to the clinic and then they're expecting to see, you know, a parent and like a young kid, and then they see me and they're like, whoa. And I'm like, yeah. And so, yeah, it leads to some funny stories. We'll get to that when we get to that in another video. But moving on. So, this clip is a really short one. I just wanted to show you guys it to kind of show you where I am in the situation. And so, I am facing away from everything that's happening. So, that's also something I want to mention. I don't know what's going on. So for the next clip, you know, the full procedure, it is also good for you guys to know that it'll be my first time also watching it. Of course, I skimmed over it to make sure like there wasn't anything too bad, but it'll be my first real time watching the entire procedure. So I'll try to explain it as best as I can, but let's get on to the final video. All right, and so here we are with the actual procedure. The video is about 10 minutes long. Don't worry, I won't make you stay for the whole 10 minutes. I'll kind of sum it up, go through it quickly, and explain what's going on. This is about the time, though, that I do want to give you that warning again of, like, if you're squeamish, if you don't like needles, if you don't like blood that much, you might want to skip this part, you know, because this is where I kind of show the entirety of the procedure. Again, it's not that long, it's not that bad, but if you are squeamish, I would recommend you kind of skip over this part. But if you're more really curious like I am, take a seat and come with me, and we're gonna watch this video together. So right here, what the radiologist is doing right now is putting some antiseptic cleaning on my back, you know, making sure the area is ready and clean for the procedure. And if you could see, like right about there where my mouse is, it's like a darker spot. I believe that's where he marked the, that's either where he marked the area or the scar of where I've had it previously. Because up until this point, I've had them almost about once every, like bi-weekly. I've had them almost once every 2 weeks. Now that I'm in a different phase of my treatment, you know, it's once a month. But yeah, these procedures, keep in mind, were up to like once a week at the most frequent. So keep that in mind. So if we continue on with the video, he's just kind of setting things up, getting ready. More cleaning here. These are a few of the things that are going to be used, right? We got some cleaning agents. This is the chemo syringe. So this chemo right here is a little chemo called methotrexate. I'll get into that in another video when I explain what kind of chemos I get. But this yellow syringe is chemotherapy. So that will be put into my spine in just a bit. So this right here is where he starts putting, you know, clean gloves, you know, the ones that come in bags that haven't touched anything. I can't come up with the word, I'm stupid, but the word is on screen right now. So right now he put the drape on my back to kind of isolate the area. He's going to poke with the needle. He's getting the needle and the ultrasound machine sterilized. That's the word, sterilized. Perfect. But he's getting everything sterilized, ready for the needle. And so if I fast forward just a little bit over here, right here, this is the ultrasound machine. We haven't gotten to the needle just yet, but he's doing like a final check as to where, if I pause it just, you can kind of see on the corner over here the TV. That's kind of what he's seeing right now with the ultrasound. So he's just about getting ready to get with the needle and poke it. And just about now. So this needle right here is the first needle of the few that I get. You might be wondering, first needle? What do you mean first needle? You thought there was only one needle. Yes, but this needle serves more of a pain control purpose. It's lidocaine, you know, liquid lidocaine. I think it's lidocaine, but it's essentially a numbing agent for the skin. To kind of numb the area, because I am going to get a needle, a 4-inch needle down my spine. So, you know, a little bit of pain control would be nice. But this, this needle is supposed to numb the low, like the more inner parts of the skin, so it's supposed to make it hurt less. However, in just about a second right here, when he starts pushing in the liquid, just about, boom, pain, pure, unadulterated pain right here. Literally, this right here. Like, if I go into the video again, this right here is just pain. Why? Because it is fluid that shouldn't be there going in under the skin. Like, the video doesn't do it justice, but what I do in this situation when they're numbing the skin, they'll always say, oh, stinging, freezing, and burning going in. I'm literally clenching because I'm on my side, right? I'm clenching onto the side of the bed, like eyes closed like this, hands like grasping for dear life. Because I'm awake. Keep in mind, again, I'm awake during this, so it hurts. It's almost like a burning and like a stinging sensation. So it's not fun. It's really not fun. um, so this is kind of the part where it hurts the most. I'll do it justice and say this is the only real part where it hurts. But yeah, right here. Again, I'm not sure if I'm gonna have to blur this or not. There's no blood right now, but if I have it blurred, it's for a reason. But essentially, this little contraption here is kind of to hold the area in place for when they put the second needle in. But for right now, they're still poking with the lidocaine, the numbing agent. Right now, he's taking the needle out. Let me continue watching real quick. Yeah, okay, so that's going deeper. Oh, okay, yeah, that's blood. It's not a lot of blood. I might blur that, but there's blood, so you know. And so if I fast forward just a little bit, oh, right, so the reason why there's a little bit of a pause there in between what he's doing is so that the numbing agent can work. Because if he just decided to put the numbing agent in and then continue with the other syringe, well, then the numbing agent wouldn't do anything. I'd be receiving double the pain. And it's happened to me before. Like, one of the first few times I've had it done this way, I got the numbing agent, and like not even a minute later, he decides to put in the other needle, and I'm like, "Dear God!" I'm dying on the inside because it's double the pain. Like, I got pain from the lidocaine I got pain from the lidocaine, and then got the other pain from the other thing. I got the first pain for no reason, you know. And so we decided to wait a little bit from then on. And just about now, I think he is getting the second needle, the one that's going to extract the fluid in, ready. So, yeah. Oh, okay. Oh, okay. So I was wrong. So, remember when I said it was 4 to 5 inches? The first one did kind of look like 4 or 5 inches. I was wrong. I was very wrong. That one was just the numbing syringe. Look at that. Dear God. That is a metal pipe. That is a metal pipe going down. That is the same length as this syringe. That is equal lengths. I could eyeball it. It's equal lengths. Look at that. But anyways, he's putting the thing back again, and he's about to poke with the other one. By this point, okay, it went in easy. By this point, again, it's already numb, so I'm not feeling it, right? I didn't feel anything. However, there's a point in this video, if I remember correctly. Okay, I'll kind of explain it real quick what I'm like yapping about, but I remember this because it was just a few days ago. When he put this syringe in, or this like rod, this needle in, right there, sometimes what will happen is that it'll hit a nerve. It doesn't happen often, and it's not supposed to happen. What ended up happening, right, was it hit a nerve on the way to the spinal cord, and since I'm laying on my side, the nerve was hit, and my leg literally like shot out. I was like, boom. Literally, like literally, it was like I was getting electrocuted. It literally felt like I was being electrocuted. I was like, boom. My leg was it was weird. It was weird. It's happened a couple of times, and like I've never gotten anything lasting from it. But it in the best way possible. It's like getting electrocuted, you know. So not fun, but it lasts like a couple of seconds, and you're not expecting it, right? Because right after you get the freezing, you're not expecting any pain. I've come to not expect pain after the freezing because after the freezing, they tell you there's no pain, and I've never received pain after the freezing. So it's always such a shock when I get that little sting and my leg goes like ragdoll mode. But continuing on with the video, he puts in the little rod needle thing to get the spinal fluid out, and just about here, right now, I think that's fine to show. I think that's fine. You can see a few droplets coming out. That is the spinal fluid. That right there is spinal fluid. It looks like water, honestly. And the way they kind of can easily tell, like, obviously they're supposed to send it to a lab and get it tested, right? That's how it's normally done, and that's how it is done. But in certain situations, you can kind of almost eyeball it just by seeing the, like, how clear the fluid is. If it's like cloudy or anything, there's something that shouldn't be in there. But if it's clear, if it's like basically like water, clear, nice, it's already looking pretty good, right? And you know, the first time they did it, it was a little cloudy, obviously, because the first time was when I was first getting diagnosed. But right about now, it's now and forward. From then and going on, it's been pretty clear. It's been pretty good. So moving on from here, you know, actually, what this reminds me of? It reminds me of like those field trips that they would teach you about in middle school about going to a maple tree and getting some maple syrup out of it, like tapping a tree. It's a weird comparison, but we're Canadian, we know about this. Uh, it looks like that. But moving on, this is the part where the chemo comes in. So right about now, they're done collecting the spinal fluid, and the fun part about having chemo put on the back is that the radiologist can't do it himself. Legally speaking, the radiologist cannot handle chemotherapy. And so we have an oncologist here, you know, a cancer doctor, the easiest way to say it, an oncologist, cancer doctor, putting in the chemo in. They're legally not allowed to do it, so an oncologist has to come and put the chemo in. So just about here, the needle goes in, and the chemo goes in as well. This part, again, doesn't really hurt. Yeah, there it goes. And, oh, I missed it, but by now the needle's taken out. And like I said, after the freezing and after that little spasm, it doesn't hurt. In fact, taking the needle out doesn't hurt at all. It like I don't feel anything, really. And by this point, we're pretty much done the procedure. You know, they're making sure it doesn't keep bleeding. You know, they're cleaning the area. They'll take the drapes off, and then after a few minutes, I'll stand up. We're all hunky dory. We're good. So yeah, that kind of so yeah, this is kind of me at the end. Yeah, yeah, that thumbs up kind of sums it up. So yeah, that was the lumbar puncture procedure. A few of those things, you know, I might have been able to explain a little better, but just kind of explaining why it is, what it's for. Oh, something I didn't explain was why it's so important to do so. Because being honest, I wouldn't do it if I didn't have to. Why would I put myself through this if I didn't have to? The reason why it's so important is basically so that, you know, the cancer, in my case, so that the cancer doesn't spread from the blood to the spine. Basically, think of your spine as like a firewall, right? So that the cancer doesn't hack its way into the spine, and then once it like if it does reach the spine, you know, it has pretty much free access to the brain and the central nervous system, and then it can kind of just hijack the entire system after that. And if it does that, well, let's just say I would unlock a very secret ending to life and get the credits rolling faster than normal. Anyways, back to standing me.
So, there you have it. Not the most flashy situation to be in, but hey, like they say, an apple a day keeps the doctor away. Except in this situation, it's not an apple, it's a lumbar puncture, and it's not a day, it's once a month. You get what I mean. Anyways, I hope this helped you be just a little bit less afraid of the doctor. So stay warm out there, stay safe, Merry Christmas, and until next time, keep living.